All right, Anonymous Queen. I was recently diagnosed with genital HSV-2. That's herpes simplex virus 2. Other than taking antiviral medications, is there anything else I can do to prevent outbreaks to minimize passing it to someone? Yes. One, there are two types of therapy. One, taking the antiviral medication episodically. In other words, when you have an outbreak, you feel like the outbreak is coming, there's oftentimes a tingling, burning sensation of some sort called a prodrome that lets you know you're about to have an outbreak. And if you start taking the medication then, and when you feel in that prodrome, that's when you are infectious and can spread this. You start taking the medication, you take it for 5 to 10 days, and that will eradicate the outbreak. A lot of people, they'll start taking it, the symptoms go away after a day or two, and they stop taking it. What happens then is you've just knocked the virus down, but you haven't knocked it out. So you'll ultimately have another outbreak that's 10 times worse because you insulted the virus instead of eradicating the virus. So if you're on a course of therapy with intermittent therapy, take the medication as prescribed 5 to 10 days. But you can do absolutely nothing, and the average genital herpes outbreak will go away in 10 to 14 days, and you're not infectious until the next time you have an outbreak. So you can do absolutely nothing, and it will resolve itself if you have a normally functioning immune system. 2, take your vitamin D to boost your immune system, and then zinc is also good it's a good antiviral, and thiamine as well. So those things are supplements that you can take that can help boost your immune system, minimize the amount of stress in your life. Outbreaks are always associated with stress, sleep deprivation, anxiety, all of those things. But this is not a curse. This is not something where you have to go and hide. This is just reactivation of the chickenpox virus, and it's a relatively benign infection. It doesn't bother you. You don't bother it. You don't want to share it with anybody if possible. But you also don't want to introduce myself. Hey, I'm Anonymous Queen and I have herpes type 2. That's information I would not divulge until I'm in an intimate relationship, but I would definitely divulge it before having sex with the person. But it's not something that you introduce yourself with, definitely. So I've had people that really get upset by this diagnosis, and it's one of those things that happens. It can happen. It's thought that at least 1 out of 3 people in the United States of America have this, and there are 2 types: of HSV-1 and HSV-2. HSV-1 causes fever blisters on the lips and around the mouth. Now, people see that, they laugh about it. They say, "Oh, you got a fever blister. Just put some Blistex on it, you'll be fine." Well, because people now have added oral sex to their regimens when they're having intimate activities, the type 1 virus is now going below the belt. And so that distinction really is not important, because if you get it below the belt, it's going to break out below the belt. If you get it around your lips, it's going to break out around your lips. It doesn't matter whether it's type 1 or type 2. What I recommend to my patients, besides those things that I said in optimizing your immune system function, is to take your antiviral on a daily basis. That's chronic prevention. So you wash face, brush your teeth, take the pill. There are 3 different types of pills that are available. There's Valtrex or Valcyclovir, there's famciclovir, and then there's the original antiviral. The problem is you have to take it 3 times a day. And it does work, but that's just, most people will miss it. The other 2 are twice daily. The other 2 are once or twice daily. You can take a dose of 1 gram and once a day and be good. Chronic maintenance, I usually recommend 500 milligrams or 1 500 milligram tablet once a day to prevent outbreaks. Doesn't mean you will never have one, but it definitely minimizes the length of time for an outbreak and the severity of the outbreak. The great thing about a herpes infection is this, that the longer you have it, again, in a normal human being with a normally functioning immune system, the less often you have outbreaks and the milder the outbreaks will be. That unfortunately does make some people casual with their treatment, and they get slack in their regimens and they don't take care of themselves and use the chronic medication the way they should. So Anonymous Queen, great question. You might get the question of the day, and that's what you want to do to minimize passing it to someone. When you know you have an outbreak, when you feel that prodrome, do not have intimate activity, no sex until at least 10 days have passed.